Parent of Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The following programming is furnished by you and your doctor.
The content, information,
Certified home health agent.
All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Good evening, South Florida, and welcome back to another episode of You and Your Doctor by All County Care. All County Care is a Medicare certified home health agency. We service Palm Beach, Broward, and Miami-Dade counties. We send nurses and therapists into you or your loved ones' homes to provide the best care for them. And we will get right into this interview. Tonight, we have a wonderful and special guest, Dr. Jonathan Levy from the Orthopedic Levy Shoulder and Elbow Center at the Paley Institute. The Paley Institute being a world-class institute of surgeons, and he is located in Boca Raton, Florida. I want to welcome you, Dr. Jonathan Levy. Welcome to our show.
Thank you so much, John.
Yes, Dr. Levy's office is located at 9960 Central Park Boulevard North, Suite 150, A as in Apple, Boca Raton 33428. It's on the campus of West Boca Medical Center, and you can reach them at 561-922-9112. That is 561-922-9112. Also, you can reach them through their interactive website, which is a great portal for even scheduling appointments. And that is www.paleyinstitute.org. That is, once again, www.paleyinstitute.org. On this website, you will see a range of information about the wonderful doctors, including Dr. Jonathan Levy, a board-certified orthopedic surgeon specializing in shoulder and elbow surgeries. Dr. Levy is also on staff at West Boca Medical Center, and he has been involved in quite a few peer-reviewed publications over the years. Dr. Levy, would you like to touch upon a little bit of the peer-reviewed writings and publications you've done?
Yeah, sure. So research has always been a really important part of my practice. The concept of evidence-based decision-making, right? Making sure that we don't just have a hunch of what we're going to do for our patients. We actually have the evidence and the literature to support it. So I've been involved in clinical research really since I finished residency back in 2005. 2010, as a physician at Holy Cross Hospital, I started the Holy Cross Orthopedic Research Department. Wonderful. And really kind of jump-started a career in academic research. I mean, it's not
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. Our number is 954-717-7027. We are a Medicare certified home health care agency servicing Palm Beach County, Broward, Miami-Dade. My name is Louise Gomez. I am your host. And today we have the privilege of introducing Dr. John Conde, who is at Conde Center for Chiropractic Neurology. The address is 401 West Atlantic Avenue, suite number 14, Delray Beach, Florida, 33444. He can be reached at 561-330-6096. And the website, thecondecenter.com, and email is info@thecondecenter.com. Thank you for making it to the show.
Thank you for having me. This is wonderful. I love to talk about health.
You know, we appreciate you coming to the show. We know doctors have very busy schedules. We know that you're overworked, and we appreciate you taking time out of your schedule.
My pleasure. My pleasure.
So I just want to share with our listeners, our viewers, a little bit more about you and what you specialize in. So maybe you can share with a little bit about your experience, your education background. Where did you go to school?
Problem. So I'm a board-certified chiropractic neurologist. So people say, what is that?
That's interesting.
Not everybody even knows what chiropractic is. So when you talk about it being a specialty within chiropractic, they're like, what is that? So within our profession, we have specialty routes like medicine. We have orthopedics, we have radiology, we have pediatrics, but we also have neurology. So I did a 3-year postdoctorate specialty in neurology, really focusing.
We're going to grab a mic. We're going to give you a mic.
No problem.
Okay.
Got a mic.
Thank you.
Is that better?
I think so, yes. I think it should be good.
So, so I did a 3-year postdoctorate specialty in neurology. And what does that mean? Well, it means that we are really experts in the way the brain and the nervous system work, right? And having that real good expertise in terms of functionality of how it works, we're able to provide elite level rehab for your major neurological conditions that make us that's our niche for, so
like
patients with brain injuries, patients with stroke, patients with severe dizziness, patients with Parkinson's or MS. We have the ability to really have a good functional diagnosis of what's going on, and then create a really nice treatment plan using the latest technologies and therapeutics and research to really get these patients better.
What are some of the, I'm sorry to interrupt you. What are some of the, you piqued my interest, what are some of the latest technologies if somebody comes to you and they have like a brain injury and they're presenting with symptoms?
So brain injuries now, traumatic brain injuries are really, really kind of hot because of a lot, really because of the NFL, the football league.
Oh, sure.
And we've really heard all this about concussions and what's called CTE, which is chronic traumatic encephalopathy, and all of this, and a lot of research. But basically, we're able to now put a patient through a diagnostic kind of battery to look at everything from cognition. So we're able to, within a 20-minute test, understand if this patient has impacted cognitive function, meaning are they able to plan, problem solve, how's their short-term memory, how's their critical thinking, how's their processing speed, reaction time, all these different things. We're able to get an actual number to see how they're doing compared to their peers in their age group, right? We're also able to put them through reaction time tests using really sophisticated digital boards where they're having to depress targets and really measure their speed of being able to process visual information.
Okay.
We're able to measure them for balance tests, putting them on what are called posturography platforms to really measure the small little nuances of sway patterns, all these different things.
I've heard that balance as we age is a huge indicator for mental cognition.
Huge. Yeah,
so
huge
I do some balancing exercises.
That is fantastic. You put those together. That's what I tell my patients all the time. Your balance is not great. Your cognitive processes may follow.
Isn't that interesting?
Yeah.
So you're able, from what I'm detecting, you're able to pinpoint and kind of specialize. You're able to detect, okay, this particular patient presents with this, this, and this. So now you can have a targeted type of.
That you are wonderful. You are. I need to put you on the payroll. You have.
I love it.
You are.
I love it. Thank you.
Targeted is what we preach.
A targeted
approach. So
because you're able to
identify
identify. I love that.
These areas that are really functionally deficient, and this is all evidence-based.
Yes,
the wonderful thing is we have so much information now to detect these areas that are not working well, and then really get targeted treatment plans to get them to strengthen.
I love that.
So the buzzword in neurology is called is neuroplasticity.
Oh yes,
Okay.
I'm familiar with that. Can you share with the audience more about that?
So
I love that.
neuroplasticity basically means that the brain can be molded and shaped and remapped and reorganized according to whatever stimulation you're giving it.
Right.
So you have this wonderful ability to make an enormous amount of change in the brain.
At any age, right?
At any age.
I love this.
Which
at
is
any
wonderful.
Age. Okay.
Any age. And basically the premise is, without getting too scientific, is that you have these nerves, these neurons in your brain and your nervous system, and like a muscle, they need to be activated.
Right.
The difference is the neurons, we can't do weights with our head,
Correct.
right? With our brain. It's not. So we need to do therapies to activate and stimulate the neuron, and that allows it to then grow new connections.
Yes.
Those new connections are the hallmark of neurological improvement. So the medical term is synaptogenesis, and synapto means connection, genesis means new, so we have new connections, right? So we treat a large part of the population for neurocognitive deficits.
So it's like a
Pre-Alzheimer's.
Neurobics.
Neurobics is the old school way, but
Right?
that's absolutely
because
wonderful.
You're now taking that exercise and creating a mental brain exercise.
That's right. Yeah. So neurobics is a great generic kind of way to approach things, and neurobics talks about using your left hand if you're right-handed for the remote control. Brush your teeth
I
with
started
your left
doing
hand.
that.
Good.
I'm onto this.
Good. There
I'm
you
onto
go.
this.
There you go.
Yeah.
So that's neurobics, which is wonderful too. It's a general health
sure.
type thing, but yeah, very good.
Oh my God, this is all, I love this stuff, right up my alley.
Yep.
So,
absolutely.
what other types of conditions, or what other types of things do you do at the practice?
So patients come in to us with all different types of neurological issues. We have a lot of medical practitioners that'll send us, dizzy patients, because dizziness can be very vague and difficult to really assess. So we're really able to find those patients that are chronically dizzy and get them better. But we do a lot of brain injuries, concussions, athletes that hit their head, or even just seniors that are bike riding, or they went for a walk and they fell and they hit their head and now they have a concussion. We're really good at treating those. Neurocognitive is getting big. Obviously, as we get older, we really want to have elite use of our brain.
Yes.
Meaning, we want to keep our cognitive processes as good as they can for as long as they can.
Mm-hmm.
So we have same type of thing. We're able to put the patient through a kind of an exam protocol, and then develop a really good plan to improve those cognitive numbers. So we're really big on keeping track, objective track, in terms of, it's great when the patient tells you, hey, I think I'm doing better, or I can, but we want to have data that says, hey, you are truly doing better. So neurocognitive, dizziness, concussions, stroke, patients with stroke that really have done the physical therapy, or they've done the occupational therapy, and they still are, they're still having some deficits. We're able to take them and get them a little further along. So that's really kind of our niche, our expertise,
I have a question. So what would be the difference between a neurologist and a
medical neurologist, or a chiropractic
correct.
neurologist?
What is the distinction?
Great question. So our training really focuses on the way the system works. So we're really masters at understanding the actual neurophysiology.
Okay.
That's what we spend most of our time on. And then so we can understand how pathways work, when pathways are broken, what kind of disease process we'll get. And so we really have the intricacies of how that works. Then we really specialize on these kind of novel therapeutic approaches to really help then stimulate the system to get it stronger and better. In neurology, unfortunately, there isn't a whole lot of great treatment options
I see.
in terms of medications
Right.
or surgeries. Most of what we know that we have great impact on is by applying therapies and exercise and rehab. That really is kind of the what we know really makes a difference. So the medical neurology, which I have great colleagues that are medical neurologists that we work
Sure.
hand in hand,
Nice.
they work more with diagnostics, medication, follow-up,
Okay.
ordering different things. So we work hand in hand, but there's a little distinction in terms of how we approach it.
So as a chiropractor, are you also giving them an alignment, an adjustment?
Great question. It depends.
So-
It depends
okay.
on because that's my foundational training.
Right.
If the patient, I believe, has something going on with their spine that I think may be contributing to the neurological problem,
Right.
absolutely. For example, some patients get dizziness from their neck.
Okay.
We call that cervicogenic vertigo.
Mm.
And because they have a problem with their neck, it actually
Okay.
can make them dizzy.
I
So
see.
we can actually do some muscle work, maybe even a very gentle manipulation to get that area working better, thus helping some of the dizziness. So yes, it's a great question. We do address the spine and a lot of these issues as well.
That's interesting.
Yep.
I don't think there's a lot of chiropractic neurologists.
There aren't, no.
I feel like it's such a niche
Yep.
field
It is.
that
It's
you're
a niche
in.
field. Yeah. In Florida, I want to say we probably have about maybe 20 or 30 in Florida,
wow.
scattered throughout the state.
Right.
And we all have a pretty, we all keep in touch with each other, and we have a
course,
good
it's-
relationship, so we're able to share information, share new research that's out, or
Wonderful.
kind of keep track with each other at conferences and that type of thing. So
Wonderful.
yeah.
Now, do you also incorporate lifestyle or supplements or
We do.
diet, day to day?
Absolutely.
Okay,
That is
tell me
a
about
great
that.
question. So, to reinforce
Yeah.
the changes that we make, you have to have a level of change in your nutritional and dietary aspects, right?
Sure.
We know that the brain, in order for it to change, it needs three important things.
Okay.
One is going to be oxygen. If you don't have oxygen, you have a stroke. So we need to make sure you're well ventilated. You're taking in enough oxygen. So a lot of times we'll train patients to breathe properly. Show
Good.
them how to breathe
Yes.
well. We'll refer them to certain books or something to show them proper breathing aspects. The other is going to be fuel. Fuel, it means anything that makes the neurons work better and optimally. So we want to make sure that they are fed well, in the sense that the brain uses up a lot of carbohydrates, glucose.
Okay.
So people say, oh, I'm on these low glucose, low carbohydrate. Well, it's good for some things, but not the best for brain, okay?
Interesting.
So we want to look at dietary aspects, make sure that they're not doing things that are really affecting and restricting food stuffs that are important for brain activity. Also, we'll dive into nutraceuticals. Are there anything that we think is great for that condition? For example, we know that for traumatic brain injuries, one of the most well-researched nutraceuticals is simple omega-3 fatty acids.
Wow.
Okay, it's really had some great research. So we're able to recommend something like that to be a nice, complement to what we do. And the last part is the activation part, which is what we do with all the therapies. But that fuel, that part where we, kind of have to make some dietary changes or guidelines is very important. Sometimes a patient may come in and they'll have an allergy to wheat, right?
Yes, very common nowadays.
Very common.
Very common.
Or they'll have an allergy to milk
Right.
proteins. So we may order some tests to confirm that, to see if
Okay.
that's an actual situation.
Sure.
And then we guide them and give them recommendations on what to eat, what not to eat, and that type of thing. So, yeah.
So, like, I've always heard, and I grew up eating the Mediterranean diet. So, is it true, like, olive oils and coconut oil and, let's say, avocado oil?
Wonderful.
Those are all good for the brain?
Super grain fed. See, your brain is mostly fat and water. Mostly fat and water. So you need to hydrate, right?
Yes.
Hydration is key.
Right.
And then you need to have good fats. Hence the omega-3s we talked about. But yes,
Sure.
olive oil, coconut oil, grapeseed oil, all of those are wonderful for enhancing brain activity. Yeah. So
it's amazing.
and on the same
Yeah.
level,
Yeah.
we also want to get rid of other foods that can give us bad fats. So like heavy fried foods that are cooked
Sure.
in bad oils,
Sure.
or red meat's okay, but sometimes if you eat too much red meat, it has a lot of bad fats in it. So there's certain things you want to
Yes.
look at, right, according to what's going on with your condition.
Now, when you say bad oils, I've been reading a lot. They're talking about, like, I guess these seed oils or canola oils.
Uh-huh.
I've been seeing it now more than ever. It's
Yep.
become very prevalent.
Yep.
So are those oils maybe something that are not?
They're on the side we don't really want to use as much.
Right.
Yeah.
Got it.
Yeah. They have a history of having certain types of fatty acids that are make the cells a lot more rigid, and they're
Right.
just not able to work the way they
Okay.
should.
Okay. Now, Dr. Conde, do we need a referral to see you?
Absolutely
or how
not.
does that work?
No, you
So,
pick up the phone, make an appointment, and come and see me.
Okay.
So we have an office in Delray Beach.
Okay.
And we've really over the years been blessed to be able to grow and expand. So we have a pretty large operation there.
Wonderful.
We have about 15 employees.
Oh, wow.
I call them
It's-
team members because
like
they're
that.
wonderful team members. They're all
course.
great. They really are well trained. I like to call them a world-class team.
I love that.
And then we have really the latest technology in terms of neurological care. So I really enjoy being able to leverage technology for patient care so these patients get better faster.
It sounds like you have a lot of cutting edge. It sounds like you have a lot of the latest technology where people would want to, come see you because you're able to do these assessments.
Yep.
And
yeah,
you're-
we really enjoy it. So.
Yeah, wonderful. So everybody, we have Dr. Conde, and the phone number to reach him is 561-330-6096, and the email info@thecondecenter.com, same as the website, www.thecondecenter.com, and they're right here, local, Delray Beach, 401 West Atlantic Avenue, Suite 014, Delray Beach, Florida, 33444. Thank you so much for
Oh my
coming.
goodness! Thank you
so
so much. I
appreciate it.
appreciate
I've learned
you.
so much.
Thank you. You are very knowledgeable as it is. So
I
this was
try
an
to-
easy
I try to-
talk.
Yeah.
Well, thank you.
We do have a couple minutes left, so I
Okay.
wanted to ask you. I thought we were almost done,
That's
but
okay.
I wanted to ask you. Can you share with us maybe a couple of stories?
Sure,
Or,
sure. That's a great idea. Yeah.
yeah,
So
like some stories of some people who came in with one thing and then they left.
absolutely.
Yeah.
So just today we had a patient that had been coming to us for the last couple of weeks with really severe vertigo, dizziness, just spinning round and round, and although most of the time when we see this, it's usually due to a little crystal that's dislodged in the inner ear.
I've heard that.
However, sometimes it's not a crystal. It's actually the connection from the inner ear to the brain. Those are more difficult to treat.
Oh, yeah.
So this patient actually had a little bit of both. Okay, we
Okay.
had a situation where she had what's called BPPV, which is that crystal
Yep,
condition.
I heard about
But then she also had a vestibular hypofunction. Don't worry about all that. But it just means that one side of the inner ear not working the way it
Okay.
should. So we were able to treat her, put her through some different therapeutics over several weeks. And today she came in, and I haven't seen her in a couple of weeks, and she's symptom free for several weeks, which is wonderful. So
That's amazing.
she's thrilled. I'm thrilled because you see somebody suffering and not being able to enjoy life. It's difficult. So she's doing great, and that's a wonderful.
That's amazing.
Wonderful feeling. So, and we've also, most recently had if I can think of another one here, a brain injury, a concussion.
Okay.
Those
are tough.
They are, especially when it's chronic and they come to see us
yeah,
after
they're
it's been 6
struggling.
months, a year,
Yeah.
and they just every little thing creates a problem. They're sensitive to everything.
Sure.
If they get tapped in the head one time, it's because their system is so fragile and it hasn't really recovered well. So in this particular situation, we put this patient through a lot of neurocognitive rehabs, a lot of things stressing different parts of cognition, like, sequencing, timing, planning. We have something called an interactive metronome, which is a timing mechanism that we do according to a beat that's generated from the computer.
Okay.
Really great for the very front parts of your brain. But we put him through a lot of therapies, and he's doing fantastic. He's scoring a lot higher on all his tests.
That's amazing.
He's able to function more clearly and less brain fog.
Love that.
Just less dizziness, more stability, and being that it's a young kid,
yes,
it's a wonderful feeling.
It's such amazing.
Yeah.
So, Dr. Conde, we actually have 1 minute left.
Okay.
If we can just leave the audience, if you want to give them a piece of advice or what they should do if they're whatever you want to say with that 1 minute left.
I think if we're looking at brain health,
Yeah.
We talked about the brain being fat and water, so we
Yep.
want to make sure that you're hydrating.
Yes.
Hydration is key.
Absolutely.
You want to drink, I'm going to be conservative, but at least like 4 glasses of water a day.
Sure.
Should be more, but we'll take 4. You want to eat things that are going to be more anti-inflammatory, so less of the heavy fried foods and more of the lean meats, more of the cold water fish like salmon, cod, herring, sardines.
Yes.
You want to have good veggies. You want to have good fruits, blueberries, top fruit out there, okay, in terms of antioxidants. And then you want to do some things to enhance activation and movement. I recommend simple, doing 5 days a week, 30 minutes of just walking. Go out for a walk.
Absolutely.
Okay? Do those things, and I think you're already, ahead of most people. So.
Wow.
Yeah.
Well, thank you so much for coming.
Thanks
we
again.
so
I'll
appreciate
take another
you
handshake.
and all the work that you do.
Thank you so much for having me. This was
And
wonderful.
thank you.
guys do have a great
Absolutely.
operation here. So.
Thank you. Have a great night, everybody. Thanks for tuning in. And we will see you next week for another episode of You and Your Doctor. Have a great night.
Share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422 and we will put you on the air as soon as possible.